Me now is Dr. Nili Kaplan-Myrth, a family physician based in Ottawa. Good morning, doctor. Thanks for being with us. So, what do you think about the announcement that we heard earlier today? Is this going to help with the healthcare crisis in Ontario?
No, it's really not, and it's insulting. The plan is not to stay open, but the plan is to stay in crisis. I don't think that the government has actually acknowledged the reasons that we're in a healthcare crisis. Increasing the role of privately delivered but publicly funded care isn't good for anyone. We should be putting our efforts and our emphasis on public care. Increasing surgeries in private clinics does not address the shortage of doctors and nurses. Increasing the number of international nurses who are able to register in Canada does not address the underlying moral outrage experienced by nurses because they haven't repealed Bill 124, because they are disrespecting nurses. So you're bringing in nurses from elsewhere to send them into unsafe and undervalued working conditions. Sending patients to who are waiting for long-term care to homes not of their choosing is disrespectful and dangerous for our seniors. Those same seniors who are already neglected in private long-term care settings are now going to be taken away from their caregivers, from their families, from their community. And most of those seniors do not have the power to advocate for themselves. So even though we're told they'll have the choice to refuse being transferred, how many of those vulnerable seniors are actually going to be able to exercise that choice? We are taking our most vulnerable, powerless members of our community and letting them be harmed again and again. What we needed to hear from the government, what we needed to hear from Sylvia Jones, is that we are going to focus on solutions that support public healthcare, that are focused on prevention and being proactive rather than reactive. There was no mention whatsoever of family medicine, of the importance of primary care in the community. You want to keep people out of hospital, you need to support primary care. We need to reduce the burden on emergency rooms and specialists and improve population health. None of that is in their plan.
Was there anything in the plan today, it's called the Plan to Stay Open, that you liked, that you saw as a positive step?
No, just simply no. And like I said, it's not a plan to stay open. It's a plan to ignore the reasons that we're in a healthcare crisis. And I know that there have been headlines saying that, this has been a summer in which we've been struggling, but it's been a lot longer than a summer of struggle. And if you'd listened to the emergency room physicians, if you'd even if we had done what we could and used our tools to prevent the wave after wave after wave of COVID, we would not be in this situation. But some of the issues are so much deeper than that. Some of the issues are fundamentally disrespecting nurses, fundamentally disrespecting and neglecting our seniors, and the fact that the government is looking for ways in which to boldly privatize medicine should be a red flag for anybody in Ontario who doesn't have the privilege and the wealth to buy themselves care.
Doctor, a final question for you this morning, because you said a lot, you are so passionate about this. Clearly, if you could wave a magic wand today and make one thing happen, what would it be?
Honestly, I think that the one thing that should happen right now is they should repeal Bill 124 and start treating nurses with respect.
Which puts a cap on the amount of money that they can make.
Yeah. Don't bring in people who you're going to underpay, who are desperate for jobs, bringing them into Canada to put them into unsafe working conditions where they're going to be just as burned out as our current workforce within a matter of months. It's not fair.
Dr. Kaplan-Myrth, she is a family physician joining us this morning from Ottawa. Thank you.